Good evening, good morning, Erev Tov, which is good evening in Hebrew. I'm so happy to be here. And this week, Rose is here because last week she was not missing in action. She was with her family on vacation, but she is here this week, and I'm very excited to see you, Rose. Hi down there in Queensland tonight.
Hi, Tova.
Queensland.
Good morning. This morning, we're lucky to have Georgie Oldfield. Now, Georgie is actually a physiotherapist who realised that patients didn't always get better with physiotherapy. Just like Tova realised as a chiropractor, the patients didn't always get better. And Georgie went on a mission. How's that? She went on a mission. She met Dr. Sano. She realised that she could actually create or recreate Dr. Sano's model, plus more, in the United Kingdom. So Georgie is going to run us through a little bit about how she came to meet Dr. Sano, how she developed SERPA in the UK, and now she actually teaches practitioners, doctors, psychiatrists, physiotherapists, social workers, etc., to have maybe easily put as an emotional focused therapy with the patient, along with their modality that they have already learned. They have an emotional focus on top of that. And what will happen for any therapists that are listening is that they won't lose patients, then patient numbers will grow because the story gets out and it grows and it becomes a ripple effect. And thank you so much, Georgie, for doing all this for not only the UK, but worldwide.
Yeah.
And please tell us a little bit about yourself first and a little bit about your mission. How do you like that? Do you think that's the right word for it? A mission?
I think a mission's a great word. That I think this is a mission globally that we're all doing, isn't it?
Yes.
Yeah,
yes. Yeah. Yeah.
Okay. Well, I suppose the start was when I was working with the National Health Service as a physiotherapist, and I just developed an interest in pain. And I think the reason I developed it was because I realised that there was so little that we could do for people with chronic pain. So not necessarily the acute pain, but the ones that was more resistant to treatment, or people that kept recurring with similar problems. And I became interested, actually partly with my own pain as well. I remember at the age of 40, I'm 60 now, having pain in my fingers and only being able to drive like this and not being able to bend these fingers. And you know what? It's not easy being a physio when you can't use your hands properly.
Trigger finger? Was it trigger finger?
No, it was an arthritis, basically. But in my head, I began to think, is this rheumatoid arthritis, which is a more systemic condition, or is it osteoarthritis? And we all think, well, as I'm a physio, chiropractor, osteopath, we use our hands a lot, then we're probably going to get arthritis. Oh my goodness, what am I going to do in my career if I can't use my hands, etc.
You didn't insure your hands?
Sorry?
You didn't insure your hands?
I didn't, no. And I just had this belief, as we do within certainly within physiotherapy, that as we get older, then it'll be harder on our hands. And then I went to see my GP, who also was concerned it was rheumatoid arthritis. And what I hadn't realised was that over this time, I realised the pain was getting worse and really quite debilitating. And he referred me to an early diagnostic clinic nearby, and I saw the specialist. And what I didn't realize at the time was that when he said the first time, oh, it's only just osteoarthritis, it's fine. Yeah, we'll take some x-rays or whatever, and I'm sure you'll be fine. And do you know what? My symptoms halved in the week before I went back. Now, I put it down to the fact that I had acupuncture from a colleague. And the next time she did another treatment. And I went back to him and he was saying, oh, it's just osteoarthritis. Yes, you've got arthritis in your fingers and feet. And there's a loose body in your thumb and it still clicks every now and again, and in my toe. But he said, you're fine, just go back to normal. And I said, well, what about things like tennis? Can I play tennis? Just do what you like. Now, I am so pleased that I met him just literally just saying, it's not a problem, it's just arthritis, it's part of getting older, that my pain just resolved on it. But I had that second acupuncture treatment. So in my head, it was the acupuncture that had actually resolved the pain. And I began training in acupuncture, and I did that for many years. And that, plus a form of reflex therapy in spinal pain, treating spinal pain through the feet, which was having good results, especially with acute pain, made me become more interested in actually, it opened my eyes up a little bit as well. When I look back, I can see, yes, it was a challenging time in my life, and I can understand why I would get pain. Bearing in mind that I'm 20 years older and I don't have any problems with my fingers. Yes, I've got sort of thicker joints, but I have no problems with them.
And I just want to be on the record,
yeah,
on the record for 3 women that are aging very well here, that aging doesn't equal arthritis. And the way we respond or react to our aging will determine pain, and that's a whole nother show, but I just want to put that on the record.
Yeah.
So basically, arthritis, wear and tear, degeneration is just a normal part of aging, or as Dr. Sani used to say, grey hairs of the spine. So yeah, so I still have my degeneration, but I don't have
pain.
There's
no pain.
There's no pain. So it's when people link with, the fear of being told they've got arthritis, and then they link that with pain. So yeah, but as we know from all the so much evidence that you cannot look at a specific MRI scan and link it to the amount of pain somebody has, because so many people who don't have pain have spinal degeneration or other degeneration in other joints. So basically, I then left the NHS because I was really getting interested in working more with people with pain, and I wasn't having the opportunity as much in my work, in the job I had at that time. And so I set up my own clinic back in about 2005. And really was working still as a physiotherapist, but also using complementary therapies, and actually finding that those were having really good results, sometimes with chronic pain as well, but often the chronic pain ones, the pain either would come back or it would be a different pain they present with. So this was why I started questioning myself. First of all, why do people keep coming back with different problems? Why, if they've got back pain, are they okay for a few months and then it goes again? Why do people, including myself, so many people wake up in the morning with pain, and if it's neck pain, blame the pillow that they slept with for months and years? And it just wasn't making sense, all these anomalies, and people would present with their scans that didn't fit with the symptoms that they were showing. I had a few people who had really severe actual degeneration in the spine, one with stenosis, being told they needed surgery. And with my very gentle treatment, playing around with their feet, as my husband used to call it when I was doing the reflex therapy in spinal pain, they turned down the surgery. They didn't need the surgery anymore.
Wow.
But I couldn't understand this because I didn't know the evidence base around MRI scans and people without pain having these signs as well. And then other things would happen, that people without any sign whatsoever on any test, they still had pain. And then we're trying to sort of find a little thing like, oh yes, the shoulder's higher than the other. And tell you, I've got one leg shorter than the other. I have my head go, I shouldn't tell you this, everybody are looking now. My head going slightly to the side from a horse riding accident. And all these things that I used to put down to the problems I had with recurring neck pain, sciatica, back pain, bowel problems, you name it, I had it. Oh, Rose is gone.
She'll come back.
Yeah.
I think like one of our grandkids walked into the room, but anyway. So continue.
Yeah.
Yeah.
And so, yeah, it was all these questions I was asking myself, and it didn't make sense. And then what happened was, when I'd left the NHS, I woke up one morning with sciatica, really debilitating sciatica. And what do you generally do when you've got pain? You sort of tense and you get all tight, and I couldn't bend forward because I was in pain, because I was bracing for the pain. I couldn't put my shoes and socks on, and I was in pain for 2 or 3 weeks. And then I went to see a lady who'd been recommended to me. And I went to her for treatment. She was the first person who ever said to me, so what's going on in your life?
The famous sentence. What is going on? Wait, Rose is back. Rose is back. Hold on. I just want to hear this. Rose just came back in the nick of time. So I want to just catch you up, but I'm glad you're back. So Georgie woke up one day out of the clear blue with sciatica. She couldn't move. She went to see a woman who said to her, "What's going on in your life?" Okay, so continue.
So that was the first clue.
Were you shocked? Were you like shocked?
I can't. Oh no, I wasn't shocked. But the only reason I wasn't shocked is that I had actually visited her the week before with a client of mine who had very strange symptoms. Basically, she had pain in the skin on touch. So, and it was anywhere in the body, but more on the left. So if she stood, that was her best position because only her feet hurt. If she laid down, the whole of the back, her back and the back of her legs and everything hurt. And it just didn't make sense. And I remember going on our interactive Chartered Society of Physiotherapy online platform. And people were saying, well, have you tried craniosacral therapy? And I thought, well, I knew of this woman who did it, but I'd never tried it myself. So I didn't know much about it. So I just said, would this lady like to go and see this lady I'd heard of? And I asked them both if I could sit in. So I'm sitting there with my sciatica in pain, sitting very awkwardly, listening to this lady say, so what was going on in your life when the symptoms began?
Wow.
And her husband had died 7 years earlier, and it was on the left side of the heart. And I'm sitting there going, oh my goodness. Whereas the other lady, the lady didn't come back. To her, it was just too much, and she wasn't ready for it. Whereas I immediately booked an appointment.
Interesting.
And of course, I just left the National Health Service. I didn't have a monthly salary anymore. My husband's self-employed. I didn't have I'd stopped paying into my pension, so I had to consider that. So I was fine. I was so fine.
You were fired up.
I was absolutely fine.
This is the mission. This is where the mission began. This is where the keys to chronic recovery began.
Well, it certainly lit something within me to a real interest. Yeah. And then over the I then began reading and reading. In fact, I remember going to another therapist that I used to see, and he and I were really intrigued by what this lady was doing, Kay. And so we booked a half day with her for her to actually, well, what are you doing? With your hands, what are you feeling? Because it feels like she's doing nothing. Of course, you can't learn in half a day anyway. But it made me really think I need to start looking and find what, I kept, because I was going back to her every time I had pain. And it increased the amount of time I had pain, excuse me, from leaving the NHS. So rather than being every few months, it was every sort of 2 or 3 months that my neck would go or my back would go or whatever. And then I began to think, well, why do I have to keep going to you? Surely, if you're saying it's what's going on in my life, then surely I can learn to do something about that myself. And with all the reading I was doing, I then came across Dr. Sarno's book, the first book I came across of his, which I think was Healing Back Pain. And I think I mentioned to this when I spoke to you before, that as I was reading the book, halfway through the book, I woke up in the morning and I couldn't move my neck. And I knew what it was because I'd read the book.
See how you handled that. See how you handled, because so many people will call Rose and call me and say, I feel worse after talking to you. And we'll be like, it's good.
Things are stirring up.
Rose will say, after Rose's treatment, she'll say, go now and lay down, have some tea, put your seatbelt on. So fascinating that happened.
Well, because I was reading the book and it was I was about to go on a visit somewhere. So I was aware that it was going to be challenging, this visit. So I just thought, oh my goodness, I can see what's going on. But I hadn't reached the part in the book that told me what to do. So I had to just deal with it for 3 days. And then actually when the stress or the issue resolved and things changed, within an hour of that, my pain had resolved. So that was such a thing. I suggest people keep an evidence list of things like that make you realize this is not a physical problem. So how could I have a physical problem in my neck if when this stress eases, without doing anything, the pain goes. So it was a really good insight, like a real epiphany reading Dr. Sarno's book. So I continued to work on myself with the little information I had from his book, read every book I could find, which weren't as many then as there are now, and really began to sort myself out first. I then I couldn't stop myself from then, as we can't, sort of recommending it to patients and suggesting it. And I literally used to buy a box of 50 books from Dr. Sarno that would be shipped to me, not from his books, not from him personally. And I would sell them at, not really making a profit, not a great private practitioner, am I? But anyway, I did that for a good number of months, and I just realized, and the results were so good. It just made me really realize I need to do something about this. And there was nobody in the UK that I could find. There was nobody in Europe. And so I ended up ringing around first of all, I have to admit that I didn't ring Dr. Sarno first of all, because to me, he was up here. And I just thought, I can't ring Dr. Sarno, And what I did was I contacted Dr. Mark Sofa, who wrote a chapter in Dr. Sarno's book, The Divided Mind, and he's written his own really lovely book, actually. And I thought, to me, that it was good, because I was thinking, I've got cousins in New Hampshire, so and he's in New Hampshire, so that's why. It's not that I'm scared of going to see Dr. Sarno, it's just that it's easier, and I'll see my family.
Good excuse.
Yeah, I think I was fooling myself. Anyway, he said, well, I'm a GP, so I wouldn't necessarily, if you came to shadow me, I wouldn't necessarily have TMS patients that day. So in the end, and he said, you need to contact Dr. Sarno. And so I did, and managed to have a chat, and it was fascinating, even just the discussion with him.
He was able to see you, like you said.
No, we had a chat initially on the phone. He used to give time for people who wanted to ask questions, and his secretary Mary sort of booked me an appointment, and then on he came, and I remember him saying, well, you're a physiotherapist, so how would you be able to diagnose slip discs or prolapsed discs or whatever? And I remember standing up to my full height of 5'1", not knowing actually that was taller than him. And I was standing there going, well, actually, Dr. Sarno, in the UK we triage, and actually some of us do decide who needs an MRI scan or whatever. And he had never accepted anybody but doctors, I think, before then, and presumably psychotherapists. And he just said, well, I suppose you better come and visit then. So I did. So that was November 2000.
This was how many months after the arthritis, the non-arthritis in your hand? How many months or years?
The arthritis bit was 2000. Yeah, 2000. The coming across Dr. Sarno's book was May 2007, and speaking to him was November 2007.
Okay, so from May to you only took 5 months.
Yeah, I just, if this right from the word go, this has been a calling for me. I could see it. I absolutely, and I have to learn. I have to find out more. And there were no courses, no training, or nothing. So it had to be Dr. Sarno. And so I went over to visit him, spent a few days, shadowed him, learned as much as I could from him, went to his seminars that he used to have in the evenings, and his Q&A sessions with recovered patients. And then I came back and with his agreement set up my own training program based on his work. And what I did was in the first 3 months of setting it up, I did a retrospective pilot study. So all I did was looked at I think I had about 24 people who didn't have any hands-on treatment, only read his book and followed my advice. And we had, it was well over 80% success rate with regaining function, pain, and mood. And for these people who actually were people who'd been to pain clinics, and I think the average amount of time they had pain was 5 years, that was significant, which is why it sort of spurred me on to do more. But at first I was trying to do everything. I was sort of thinking, right, well, I need to work with my clients.
How did you know how to do a study? How did you know how to do?
Oh, actually, at that point, let me just, no, not that study. No, that was not, because I'd already done another study with somebody in the NHS who helped me. So because of that, it gave me, I remembered how that had been done. And it was a very basic one, but it reminded me, I am not a researcher.
It was probably a questionnaire that you put out to the patients.
Yes,
it would have been a questionnaire.
It was a questionnaire. I ended up doing a. So it was retrospective. It was just following them all up afterwards, and I had done the validated outcome measures at the beginning, and I did them at the end as well. So I was able to see the progress that they'd made as well.
Yeah.
But you can't do, well, I can't do everything, actually. Some people think Howard Schuber actually, I think, does everything. Sure? But I realized when I was trying to be the clinician, so work with people, look at how I could start setting up something to spread the word more, and going out and talking to GP practices, talking to pain consultants, doing this retrospective pilot study. And I just went, okay, step back now. And I'm not an academic at all. And therefore I felt actually I'm more a clinician and an educator. So that's the bit that I decided to focus on. So, but over the next few years, I then returned to the States on a number of occasions to attend the conferences that were being set up. Because in 2009, Dr. Howard Schuber set up the first one. And I think there were only something like 35 people there. I think it was Dr. Howard Schuber and Dr. John Strax who organised that one. And then from there, this is when we built this movement, really, and looked at how we can start moving forward. The next one was in Los Angeles, and Alan Gordon organised that one. And at that point, I was feeling like I need to move forward. I need to move forward with this, and because it's all very well going over to the States and having all my peer support in America, but there was no peer support in the UK.
You were still the only person in all of England that was really
that I know of. I did meet a doctor at an event on one occasion, and because he'd written a little bit about TMS in his book, I then went up and talked to him at an event when he was giving a talk, and told him I was going to see Dr. Sarno, and he actually then decided to go and see Dr. Sarno. But he then, I think he then emigrated anyway, and he was doing his own work. But yes, at that point, I was not aware of anybody else who was actually working in this field. And so I had to go over, Howard Schuber very kindly invited me to stay with him and his wife. So I was able to shadow him. And I had to say that absolutely changed and boosted the way I was working. And he's been a fantastic mentor all these years. And so then by the time it came to 2010, and again, attending the conferences and learning what I could and reading absolutely everything I could in the meantime anyway, I felt I wanted to move forward as far as setting up an organization, because there was no training anywhere worldwide in this field. And there also, I felt that if I'm working with clients, only working with clients, it's going to take a long time to spread the word. Whereas actually, if I'm then teaching practitioners to then use this, then we're spreading it out more. Exactly. And also by setting up a course, it means that they're not going to have to go to the cost, energy and time that it took me to be able to get to that point.
Amazing.
That's what I did in 2010.
Fantastic. Okay, so just as an aside, did you get recommended Sarno's book by someone else? How did you actually, you just found it in the book, bookshop?
No, I think it was Amazon. I just came across it, and I was reading, looking, just Googling for anything about pain. And it was just one of the books that I noticed, and I thought, and I remember thinking actually, well, do you know what? I'm open-minded. Let's read it. I wasn't ready then, but reading it then, absolutely, it was like a gift.
Look, Georgie, can you just talk a moment about not being glued to your profession? I'm not quite sure how to phrase that, but, you know, as healthcare professionals, we're often tied to our own teaching from our own university days, and somehow people don't take on board the fact that there's new developments. And, you know, like with Davenlu, for example, he was in the 60s, you know, that ISTDP that I do, and yet, you know, that the 60s is how long ago?
A long time.
60 years ago.
Yes.
and it's hardly known about emotional focused treatment. So can you just talk about the fact that you're so open, because your story is so beautiful? Can you just share that a little bit?
I think for me it was because I was questioning things. Things didn't make sense, and it just keep doing what I was always doing when it didn't make sense doesn't sit right for me. And so that's why I began to read and, just try and find out as much as I could. But also the fact that it was happening to me helped, in that I could then, having read Dr. Simon's book, I could not only see what was going on with my clients, but I could actually recognize triggers for myself. And in fact, for a start, one thing was when I can't remember how long after doing this, but I used to have problems with what I was told was cholecystitis, so inflammation of the gallbladder. And I used to get this just every now and again. And I never questioned it. It was physical. My mother had her gallbladder out. This is hereditary, isn't it? And then after coming across this work, suddenly it was, I had a meal, I'd been fine, had my dinner. And then after dinner, I began to feel worse and worse. And I ended up being sick and went to bed and then paused and went, hang on. Why now? I haven't had this for weeks, probably a few months. Why now? And I remember, first of all, going, when have I had this before? And I was trying to look back, like a timeline. When have I had symptoms like this before? I could only remember one thing, and it was a mammoth one where the doctor literally had to come out to me, and because I was unable to even get out of bed to go to the toilet. Now, there was, I'm not going to say what it was, but there was a significant stress in my life at that time. When that stress was eased, I need to be careful here, when that stress resolved, literally, again, within an hour, that pain just disappeared. And I had never for one moment, I was a new mum anyway, so never for one moment did I actually think that this had anything to do with emotions, because we have selective attention, don't we? We focus on what's happening in our lives and what's out there, and we're rarely aware of actually how we're feeling, and this is the trouble, we focus on pain and we don't notice the emotions. And so then I thought, okay, what's happening now? Then I was able to look at, okay, I can see what's going on now. And actually it was related to this work, because I had gone out to see a client the day before, and I'd been asked, I was doing a home visit, and I'd been asked to see her because if you're her last hope, is what I've been told. If you can't help her, she's going to be admitted and put on morphine. Okay? So she was a counsellor, actually. So I went out to see her, and I examined her, and she had sciatica. And then I started explaining about this concept. And of course, it's not easy when you first start anyway. It's not easy anyway to explain it. And I really felt she was getting there, but I also did a hands-on treatment, because I was doing that at that time, and I thought, let's do a hands-on, but in the meantime, let's see if we can get her to start opening up a bit. And the next day, I heard that she'd been admitted, and I was being really hard on myself, because I'm this caregiver, I need to rescue everybody, and she'd been admitted to hospital, I'd failed. So it really was a wonderful opportunity to look at that. Yeah. And I journaled about it, and then put it into perspective and recognized that, you know what, I was set up to fail. If you are being told that you've had months of pain, and you're going to have morphine when you go to hospital, do you really want to be better after one treatment? And she just wasn't ready for it. Even though she had said, it is funny, because last week I had a friend to stay, and we laughed for a couple of hours, and I didn't notice the pain then, but she still wasn't ready. So it was making links like that for me that helped me really start recognizing and feeling like this is something I need to do. Then when I decided to set up SERPA, I contacted my professional body, because I wanted to make sure that I was working within my scope of practice. So I actually talked to professional advisory boards and discussed things with them.
Well, that's another show if they would have said, no, you can't do this.
Yeah. Yes. Now, would I have stayed on as a physio, or would I have actually stopped doing that? I don't know. Because people say, well, you used to be a physio, didn't you? No, I am a physiotherapist. And that's why I've got my, I've been a physio for, gosh, nearly 40 years now. So I have that experience that actually has helped me in this work. And thankfully for me, just before that time, they had set up a new pillar in this scope of practice to allow people to be doing like talk therapy, learning sort of breath work, for example, or becoming psychotherapists as well, and just other things that were not your normal physiotherapy. So I was very lucky that actually that had happened just before I got in touch. So I was told that, yes, I can carry on. I had to make that decision myself, but they made it clear that I was working within my scope of practice.
That was the same for me when I started training in ISTDP. I thought, this is outside my general scope, but because I'm doing the training, I'm within the scope. And when I contacted the professional indemnity insurance people, they said, isn't that what nurses do all the time?
Yeah.
Exactly.
I thought,
Absolutely.
Oh, good. Yeah.
Yes.
Yeah.
No, that's good. So I don't think there's a problem really with
no, but we get the feeling that if we're not within our scope of practice, we're not doing we're not doing the right thing for the patients. But in actual fact, in the health area, we're actually multidisciplined, only we don't realise it.
Yes,
I think.
Absolutely.
Yeah.
And basically to fit in with our scope of practice, I was told that you need to be showing a benefit to the patients. Well, that was easy enough. I had plenty of patients to tell them that there was research behind it. Okay, that was a bit limited at the time, but it was enough. And that I'd had training. Okay, I needed to actually demonstrate that because there wasn't a course, hence setting up SERPA, but my training had come from going over to the States, shadowing Dr. Sano, shadowing Howard Schubiner, going to all the conferences and learning in that way, as well as all the reading I was doing. And that was accepted, that was okay. So easier for physios now who do our training because we've demonstrated that it is, they are working within their scope of practice.
Yeah.
So
tell us a bit more about SERPA.
Yes.
And how important it is for any healthcare practitioner.
Could you tell us what it means? I want to write what it means.
Stress Illness Recovery Practitioners Association.
Stress Illness
Recovery Practitioners Association. Now, I don't think I would call it an illness down the line, but because it's not really an illness, but it's too late. We're not changing that now.
Yeah, but it's better to use the vernacular, really, isn't it? Mm. Yeah, because people see it as an illness. Yeah. Actually, we should look at the root word and see maybe it's the correct word.
True, maybe.
Yeah, could well be. Yeah. I actually want to bring on a linguist person to on TMS Roundtable, but I haven't found the right person to actually make the connection for people that how we speak to ourselves is so important. Yeah,
absolutely. So incredibly important.
Yes.
And also you got very involved in which I'm impressed, and you got very involved with the PBD Association, the psychophysiological
disorder association, PPDA.
And that organization is just so impressive. I mean,
it is
so like in all of, and I use it a lot, and today I even went to look at something, and
so did I actually.
Like their first thing they say is the pain is real and the solution is real.
Yeah.
And I'm just like, it just warms my heart to be involved with this work, because it's it's a mission.
It is
purpose.
Absolutely. And all those people who set up the PPDA were at that first conference and the second one and probably the third one as well. So yes, it was all, and I think those were people who were just so inspired at the beginning that we knew that we needed to move things forward. And I remember saying to them in 2010, will you hurry up and get going, please? Because I'm ready and I'm raring to go and I've got a couple of people to help me. And it'd be nice to have a similar name. But no, that wasn't going to happen because we had to get going sooner.
So you moved faster than them?
Yes, but it was easier because I was on my own with a couple of local guys that were around to help me, whereas they were trying to move forward and they're all scattered amongst the United States. So having to arrange times to meet with everybody being busy, it was a lot harder for them to do that. But they got going, and then as you say, they're a fantastic organisation.
Yeah. Now tell us how many healthcare practitioners in the UK are now trained by you? And you know, lots of people comment on the side here that they can't find a practitioner who will understand that they've got their chronic pain is emotionally based, and also they can't connect to why it would be emotionally based. And you know, when I was speaking to you earlier, you've got several hundred people already in the UK, haven't you?
Not several hundred. I mean, we've trained, I think it's about 170 now.
Oh, well, that's several.
That's quite a few people.
Don't you argue with Rose.
Yeah, so I mean, I started initially training, doing with a physical course. So I would travel around the country doing the training on as a 1-day introductory course, and then I did a 5-day physical course. And then actually, I did that until 2018. And 2018, I just got to that point where things had to change. And part of that was because between us, we had 3 elderly aging parents. And I began to think, what are we going to do if I'm suddenly in the middle of a course, something happens and I can't train people? And the initial idea was to maybe start training the more experienced practitioners, but for various reasons, even though we started doing that, nobody was able to do that at the end. So by that point, I'd already had been asked by a number of people, were we going to move this training online? I mean, we did have people who had come over from the States and Australia and Europe, and I ran a course in Spain, actually. That was fun. I enjoyed that. Nice and warm.
Yeah, sounds a good idea.
You mean first you were physical? What do you mean, like a physical?
Physical. So I would travel to the venue. Oh. We'd organise the venues. We'd market it. It was a lot of hard work. But traveling around, and I just decided, having been asked by a number of people when we would be moving it online, I felt that was the right time to do it. And the other reason I did it was that many of the practitioners who trained with us were clearly wanting more support as they began integrating this work into their own, this approach into their own work. And I was trying to do that while trying to work clinically, running the courses, marketing the courses with, at that point, 5 hours of admin support. And it wasn't easy. So by moving it online, yes, it was a huge amount of work to move it online with my PA, who's now SERPA's operations manager, who's been fantastic all the way through. So Zoe was there to help as we moved things online, and she had experience in her previous corporate job of online course development, so that was good.
Oh wow, that's
just the right time. See? So, and she's still with me nearly 6 years later now, actually, as we move our training onto a different platform at the moment. So we did that, and that then freed me up to develop a membership, to actually be able to have time to support and guide members. So these are practitioners who've done the training and then decide that they have 2 free months of membership anyway when they're doing the training. And then if they want to, they can become part of our paid membership. And that means that we can provide them so much more support, some continual professional development. We have monthly webinars with people like Howard Schubiner and, excuse me, Dan Ratner, David Hanson, Dave Clark, etc. And we also have almost weekly peer support calls so that they can talk to each other, they can get to know each other. We have our own Yorkshire group, so where I live. So we've got, I think we've got about 15 of us in Yorkshire now. So we meet every month. Now we're back meeting physically again. So again, some people have their own area groups, and that's a really lovely way for people to have somebody to go to for support. And it might be their own stuff that they're dealing with in their life, because this is wonderful. It helps us as well as personally as well as professionally. And it might be questions about clients and things. And I think we can all benefit from that. So that sort of evolved since the year 2018.
Absolutely.
Fantastic.
Absolutely.
Wow. we haven't got many questions, have we?
Not yet, but there's lots of people watching, and what I would like to do, ask you, if anyone has questions out there, please feel free, for Rose or myself or Georgie. I would like to know what. So is it as if the practitioner, in other words, you're pretty much based like TMS therapist. Would we call you like a TMS therapist? Would you say that, you're talking to people, you're doing talk therapy, and then you'll also, just check their back or their neck or their, like, how would you work? Maybe you want to tell us about a case study that you have worked with that helped you, that was TMS that really, and this poor lady that husband died and walked away with that skin problem, maybe will have learned. Because I just want to mention, like, even it's I remember the movie where the skin doctor was walking down all the rage, and the skin doctor was walking down the hall, and he said, this is not a moneymaker. This is like, people are not interested to really, and he was talking from his point of view as a professional, but we're still not reaching the majority. We're working with the minority, and that woman herself, like, just couldn't hear it. And I have somebody like who's working with Rose and I now, and she, she knew this, but she couldn't even make the connection. It's an interesting story. She has ringing in her ear that's like, she wants to really chop herself into little pieces. It's bad. It's really high level. And she got it after she had her tooth pulled. And she never made the connection. And even when I told her, she was like, oh, her father had a tooth pulled, went into the hospital with an infection, and it went to his heart, and he died. And she's having TMS off and on her life, but this is like the worst, because now it was after a tooth was pulled, and maybe there was something in the tooth. It's like so clear to us, but oh my goodness, like the compassion I had for her, and she just, like, the connection that we're now understanding about our lives, our bodies, our pain. So I lost my train of thought, but it was somehow I was getting to the part where you were going to talk about a case and how you were, to educate the people, and the people that want to hear this. Once they get it, it's like, of course, they want to become a practitioner and help others. But, as you're telling us the case study, like, it's sort of like a bittersweet thing, because a lot of people don't want to take responsibility. They don't. And when they do, they're like in the game. They're like, oh yes, I know now, and I can. And she's like 2 weeks later living with her tonight is because she feels safe. So thank you for that pregame.
Well, I think how people work depends on their profession as well, because and also it varies so much. I mean, for me, I just couldn't keep on with the hands-on. I was getting frustrated with people saying, oh, it's because of I mowed the lawn, whereas they'd already said something else had happened. That's why the back went. Yes. And I got to the point where I only wanted to work with people who were really ready for this. And luckily now I am in a position where people come to me because they already know about this approach. But many of the people that, the practitioners that we train, some of them completely transition and want to do, and focus purely 100% on working with people with TMS, stress-induced symptoms. Other people look at how they can combine. So we have a cranial osteopath who actually does hands-on, but she's actually, and because you can actually, while you're feeling, it's like the craniosacral therapist I used to go to.
You feel the pulse.
Absolutely, and when there's an emotional release, she feels it. So, wow. And certainly when I was working with people, if they needed hands-on, first of all, with hands-on and they weren't ready, then I would actually do hands-on with them. First of all, I would examine them. Bearing in mind, all my work's online now, and I only work with people who've already read the books, they're on board, and they're ready to move forward. At the beginning, when people came to my clinic, I would assess them as you normally would physically and get the history. And then I would question them. The aim would be to try and get them to look at the anomalies. Okay, so you said that you just bent over to pick up a pen and your back went. That seems a bit strange. And you say you were at the gym the day before. And I begin to just get them to question things first, because that seems to be a good way in for them. And then even if they weren't ready, and it's about learning to really see whether somebody's ready or not. And the more, I know at the beginning I was far too evangelical and enthusiastic and on all the signs, but I learned actually through this to just step back and listen, which psychotherapists probably do better than physios. But I learned to step back, and partly because as a physio, especially in the NHS, you've got a certain amount of time, you've got to fit everything in the time that you've got. And I had to learn to sit back, learn to listen and observe the cues that they were giving me, which obviously in ISTP you're very aware of as well. And that took learning. I had to learn that. So by asking the questions, by learning that, and in the meantime, if I was doing hands-on, I would be talking to them, and I would be sowing seeds, and I'd be building the relationship. And often even then, by 3 or 4 sessions down the line, they were ready to. In fact, one guy I remember was sitting on. I'd worked first of all with his brother-in-law, who had an amazing recovery. I worked with his mother-in-law and his wife. And his wife was saying, "You need to go and see Georgie." So I was treating him for shoulder pain, which had come on after he retired, not unusual. And he'd had a very responsible job as, I think, area salesman in the north. And then he'd retired. And I remember him not really being ready, and I was doing hands-on with him because he wasn't ready. And then on about the 3rd session, he sat on the edge of the bed and he said, "Do you really feel that this is, that, what was it, how did he put it? Do you really think this stress is, the fact that I'm retired is important with this shoulder pain? And do you think it's maybe why I take happy pills?" Now, that was interesting because he hadn't told me that I'd asked what medication are you on. He had not told me. And he was on antidepressants, and that was his way. "Do you think it's why I'm on happy pills?" Anyway, so then he was ready, and we began to talk. And I remember him saying things like, "Well, my wife is in the kitchen, and I'll go in because I want to talk to her and I want to help her. And she's in the kitchen getting dinner ready." And his wife was used to doing that on her own, thanks very much, very independently, with him at work. Suddenly, he's there trying to talk to her, trying to be helpful.
Yeah, he's not needed anymore.
The pills are working too well.
So you can imagine, and he'd lost his status, and it was lovely working with him because he was slower to get it, but he did get there.
Let's do a study. Let's the 3 of us do a study on the people that retire connected to chronic pain.
Oh, it's very frequent.
So
it's very common.
So common.
Very, very common. Yeah.
Great story. We have a question, and it'll show some of it here. So, hi Zoe, I'll read it to you, and you can respond, Georgie. Mm-hmm. I'm Zoe. I'm based in UK. Suffered from pain for 14 years. Totally debilitating, complete pain management programs, still on severe drugs daily, do Pilates, regular exercise. I have vastly improved, but only just recognizing the potential emotional element. Listen to Dr. Sarno's book on Audible. I found someone locally trained by SERPA. I am hesitating because he is a physiotherapist. I don't really understand why a physiotherapist would be the right person to approach for emotional issues. I already have an amazing physio who gives hands-on treatment and exercise. Please enlighten me. Thank you.
Okay, that's interesting.
Perfect question. Thank you, Zoe.
Yes.
So perfect a question. And this is often the block that people have, that they think that a medical practitioner is the only person that will understand them. It's almost like a hierarchy, and they think that they're going to the top. But in actual fact, they're only going to another practitioner, but they don't realize it. But Zoe, please, Georgie, please elaborate. It's a perfect question.
It is. Thank you, Zoe. Well, as you know, I'm a physiotherapist, and I don't do hands-on physiotherapy anymore. Haven't done since about 2009 or 10, I think. And my work is emotionally focused. I work more as a mentor and a coach, and people often come to me because I'm a physiotherapist, because they feel like they will believe me, because I'm used to working with the body. So therefore, if somebody's presenting with a tendinitis or back pain or whatever, if I'm saying then, no, this is not a physical problem, then they say that they're more likely to believe me. Now, if you go and see a physiotherapist who has no understanding of the mind-body, they will do hands-on work. Many of them now do recognize that stress impacts pain, but they won't ask you, for example, or very unlikely to ask you what was going on at the time of the injury, or ask you about whether there's been any previous trauma in your life. So when you're working with a physiotherapist who understands this approach, then they have learned to help people understand the links and triggers, look at the links and triggers. They'll consider more about your personality, what stress there is currently as well as in the past. Whereas on the whole, if you're seeing a physiotherapist who doesn't understand the mind-body, then they will be examining you physically. It's the fact they don't understand the mind-body means that they can only give advice based on a physical reason for the pain. Which doesn't mean they're being unprofessional. It means how you can only guide as with the understanding you have. But there are 2 physiotherapists worldwide who are pain researchers in this in the chronic pain area, Lorimer Moseley and Peter O'Sullivan. And if you look up those, and I think is it Body Logic Physio that Peter O'Sullivan does a podcast now, debunking the myths about chronic pain. So, those are fascinating to listen to. And myself and a number of our practitioners went to a Peter O'Sullivan course. And I remember one of them saying, I bet you're really frustrated because they weren't talking about past trauma or about sort of they were talking a bit about personality. And I think their work's evolved anyway. We went a few years ago. But I was so excited because there were hundreds of people at this course being run by this physio who'd come over from Australia, who was really working. He and Peter Sullivan and Lorimer Moseley are 2 physiotherapists who really raised awareness that chronic pain, we can resolve chronic pain, and that we need to look at behaviours, emotions, and things like that.
Yeah. Well, your gallbladder story is perfect, isn't it?
Yes.
Yeah, it's
like and I can tell you another one. I can tell you another one about tendinitis that I had a number of years ago. And I got acute tendinitis standing in my mother-in-law's living room, just standing there. And I had been running that morning without any problem at all. And suddenly standing there, it was like a knife was stabbed into my left ankle. And I just laughed because by then I knew what was going on. And briefly, my mother-in-law had severe dementia and she was just about to go into home. We were just about managing to support her living at home. And she'd messed herself. And so and this was late at night and I'd been passing and the lights were on. So I went in, cleaned her up. And as I was standing there afterwards, it was like a knife going in my ankle. And I knew it was, all it was a signal that there was something I wasn't dealing with. And it was because outwardly I was trying to be calm and loving and whatever, but deep down I'm pissed off. Why me? It's late. I'm tired. I want to go home. How long can we keep going with all this? And you know what? I'm not perfect. I might be, training people in this field as well, but I didn't journal that night because it was really late and I went to bed and I woke up in the morning and my ankle was swollen, the whole tendon around the area was swollen. It was acutely painful. And if I'd been to see a doctor or a physio, absolutely, or chiropractor, whatever, absolutely, they'd have said, oh, you've got acute peroneal tendinitis. But it wasn't injured.
Not even that, but it was like, it was also somebody close to you that you cared for, aging in a difficult way. It's your mortality. I mean, we forget about mortality, it's like, oh, and you're the daughter-in-law, and this is your husband. It's like all those things
I think
together.
it's also about the fact that this person who was independent had become a child.
Yes. Yeah.
And the ankle, like there was no more you could do. There was no more running.
No.
So then, of course, the ankle plays up because I can't run anymore. I can't do anything for her anymore. And the ankle gives out. It's such a lovely, appropriate story because
it's really
it's the sort of story we hear all the time.
Yeah.
Yeah. But of course, people don't make the connection to the grief that they're suffering.
No.
And like in ISTDP, people bring up about their anger, but it's often the grief
Yes.
that needs to come up and be acknowledged and accepted.
Or not allowed to be angry, right, Rose? And then they'll feel guilty about being angry.
Absolutely, yes.
Yeah. Sure, but that's unconscious guilt, though. They don't necessarily know about that. But I just see that
there's that inability to feel joy, feel guilty,
to
feel happiness or joy. It doesn't have to be rage, does it? There's all these different emotions that can trigger symptoms.
No, it's terrible often that, it's about love, that they don't actually recognize that they're repressing their love.
Yes.
And that they're holding that back because that wasn't acceptable. And actually, one of the comments you made before, which maybe our audience might appreciate, is the fact that you said that your mother had gallbladder problems. Now, if you look at that and you see that this intergenerational trauma happens, that we hand it down.
Yeah.
And it's actually not a physical thing, it's an emotional thing that we've handed down, but we don't recognize that. Can you sort of talk a little bit more about that? Because it's an important background for us. And then that creates a trauma that's actually revisiting us later on.
What do you mean talking about it on a personal level? Or
No, just in general, the fact that as a therapist, that's part of your background story, that you're actually helping people to recognize and actually let go of or become aware of.
Yeah, absolutely. Yeah. And we very much look at, what was going on in their childhood, what has happened to their parents, for example, and recognizing that whatever we're doing with the work that we're doing, like, for example, journaling, maybe starting to acknowledge things that have happened in childhood, that we are who we are because of our experiences in life. And so are their parents. And so if there's been, let's say, abuse because maybe their parents abused them, and there are people who would say, yes, well, I can see it's wrong, so I've changed and I'm much better with my children. Why didn't my dad? Because I know he was abused. But it's a learned thing. They learned it. And luckily, at that stage, this person is learning that there's something that he can do about it. But it very much is about self-compassion, and about recognizing that, yes, it's about acknowledging and expressing how we feel, but then also looking at how can we put it in perspective? How can we learn from this? How can we change the beliefs we have around this, and recognizing this is just what we've learned, but it doesn't mean to say that is, that belief is correct, for example.
Yeah.
Yes. Yeah. Well, actually, that brings me to another question, and that is the fact that some people get insights and some don't. How do you work with that?
We do a lot of work now around slow, deep breathing. So using breathing to calm the fight or flight response down. And a lot of work around emotional awareness and somatic tracking. So that even if they don't, and this is, I think, a problem with a lot of people, is that they're in the head trying to work things out. So they're thinking, they're trying to overanalyze, they're hypervigilant, and yet actually, once you can get them out of their heads and into their bodies, often that's when change happens. And too often that can be so hard because they're keeping busy. People are either being busy and distracting themselves from whatever emotions are there, or they're engaging in them through anxiety, depression, overthinking, overanalyzing, whatever. And so getting them to actually just slow their breathing down and become aware of how they're feeling in the body can really start helping them have emotions that are released without even them knowing what they're about. Trauma releasing exercises help with that as well. You don't know what you're releasing, but through shaking and releasing, you can actually release some of these emotions.
Peter Levine type work.
Yeah, absolutely.
Yeah.
Yes.
Yeah.
I found that hugely helpful. I have to say, doing his, the shaking and the trauma releasing exercises when my father was dying a couple of years ago, that helped me so much to be there for my parents, be there with them, but to deal with my own stuff. When I had some time on my own, I'd go off in nature when I could, but that really helped me just release as well. And out of interest, there was one night when something pretty traumatic happened, and I rang a friend of theirs who's a doctor, who'd said, if there's any problem, just ring any time. And it was midnight, and I rang him. And I was up on this top half of my body, I was talking to him. The bottom half of my body was just literally shaking away. And I just let it, because I knew that was my body just releasing. He was that support I needed to, gosh, I'm having a cold, feeling a shiver while I'm saying it. But he was that hand holding for me to just keep me calm and to talk through it all. And my body was releasing through the shaking as well. And that absolutely helped. It really did.
Yeah. Well, one of my colleagues has been doing some research in that area.
Oh, right.
But it's not published yet. But the thing is that she noticed that after surgery, what happens is the patient is debilitated, or the anaesthetic shuts them down, and then this shiver happens in recovery room. And because of doing the ISTDP training, she realised that it was because of the fight and flight. You know, when an antler or whatever gets chased by a lion and actually escapes, that's when the shaking, they shake
like when
down.
The stress is done, like when the stress is over.
Release.
Wow.
Wow. I think it's fantastic, and you can see some of the videos on YouTube where this is happening, can't you?
I didn't know about the shaking. I know with a lot of the it's very interesting. The shaking part of it,
shivering.
It would scare someone. It would scare someone if that was happening, and they might stop it. I mean,
yes.
Well, in hospital, in recovery room, you have a warm blanket put on you and things like that, but it doesn't stop. It doesn't stop the shivering.
Wow.
And sometimes they're medicated to try and stop it.
Yeah, but that doesn't work either.
No, but they don't, but that's because the medical side, often they feel that they shouldn't be shaking. And Peter Levine talks about this in some of the courses that he does, where, people are thinking that that's wrong, they shouldn't be shaking, where not realizing it's a natural phenomenon for the body to do.
A normal reaction.
Yeah.
So we still have a lot of listeners on, and Michael Galinsky, when he comments, and I know it's him. Like when I see TMS Roundtable Global, someone commenting, and it's not me.
I know that, Michael. Are you?
So we always love having Michael either in the studio or outside of the studio.
Sneaky
from North Carolina.
He's always there somewhere.
He wanted to see you. So anyway, and so I wanted to respond to Zoe, if Zoe's still listening. I wanted to say something that's kind of interesting because, the mind and body are intimately connected. And so for the physiotherapist to get trained, with emotional-based therapy, it's just the most perfect, thorough coming together of a knowledge. So in response to that, I wanted to say this, and I meant to discuss this with Michael, and I'll probably discuss it another time, but remember the beginning of Sarno's work, he would do these Monday night lectures, and then he would send the clients to either a physical therapist or a chiropractor. And then at some point, he stopped doing that.
Yeah.
Now, again, if certain people could get chiropractic and physiotherapy and go exercising, and you could say, wait a minute, this is to help your body, energy, your alignment, your soft tissue. We're helping the muscle relax because the brain is taking blood and oxygen from it because it's on fight or flight. or if you're going for a run, that's good for you, but just know that you still have to be connected to the real anxiety, and the run will make you feel better. So he did, at that point, Sarno was, making a decision, stop chiropractic and stop physiotherapy and just do the emotional work. But I think we know now that we can do both together if someone might need that. And I'm not going to put someone down for going to a chiropractor or physiotherapist or for taking a pill because it helps them calm down. They have to do the work. So I think in honor of Dr. Sarno, I'm sure he would have gone there since Schubiner went there and Schechter went there and all the rest of the guys have gone there to say it's a combination of, ISDDP, physiotherapy, emotional-based work, breathing. I think it really is a beautiful mind and body. We're not just mind or body. It's bringing it together.
I think that's very true. Just a slight proviso there is that if I'm working with people, I encourage movement, exercise, getting out in nature. We actually look at how do they nurture themselves mentally, physically, emotionally, and spiritually. But if somebody is seeing a physio, chiropractor, osteopath who has no understanding of the mind-body awareness, then I would encourage them to stop. Even if it's for a short time, because otherwise every time they're going, it's reinforced that you've got a problem because we need to crack your back. We need to do this, we need to do that because there's a problem with your spine.
There has to be awareness and an understanding and an ability to separate. This is for this is for your well-being. Because remember, Sarno would say, don't exercise to get rid of the pain. Yeah. Exercise to be for your well-being.
Because it's good for you.
What?
It's good for you.
He would say, yeah. So you're going to comment on, Rose, on my little spiel there. Were you going to comment on that?
No.
Oh, okay. Anyway, no, because I wanted to be.
I would like to comment on duality, though.
Okay, good. Because I think Sarno would have gone on to say, it's okay if you understand. So is that duality? Would that been? Go ahead, Rose. I just had to make my point.
Well, duality is the cause of the idea that the mind and the body aren't one, and that what we're doing is not integrating our lives because, what's his name? Descartes said, "I think, therefore I am." And in actual fact, he should have said, "I think, and I'm part of a body, and I'm my whole person, not just my mind and my thoughts." And the Enlightenment, of course, and that whole movement has actually blocked the fact that we can only go to the doctor, we can only ask about a symptom, not about the cause of the symptom. And when Tova brings up about exercise and that, the part of our body that isn't dual needs exercise. We need movement. We get people that come to us and say, well, I've got a sitting job or whatever. That's why I've got a back problem because I'm sitting all the time. But if you think about our prehistoric ancestors, they crouched in a cave once, and they didn't, have chiropractors and osteos and doctors to treat them. It was a normal thing to do for a human being.
So true.
So the Enlightenment, duality, and all of that has compounded how we believe things. So just adding to Tova's comment.
True, yes, absolutely. And it's not black and white for anyone out there. It's so gray. It's thousands of shades of gray. It's not 50 shades. It's 1,000. And it's a very unique journey. Yeah. Rose, you've been doing this for many years. Have you ever seen somebody who's had anything the same? Together we've hundreds of years between us. It's such an art, the human body.
It's beautiful.
Yeah.
I love the body. And I love the fact that the body is an embodiment of love. And I think that it's not seen and known and explored. Now, Valerie has made a wonderful comment about her mother, who has got arthritis in her fingers, and she used to be an artist. So, of course, can't do her artwork.
Yeah.
That's not true.
Tragic. Yeah. Well, it is true, because if she's expressing love and care through her art,
Mm.
and then she judges herself about how good she is or bad she is, yeah, her fingers are going to be painful.
And
Yeah.
that's often the case, isn't it? That we get pain in parts of the body that stop us doing things that allow
That we love.
us to be creative and the things that we love to do, where we're not
Exactly.
distracted and we are just in the moment. And at that point, there often are these other emotions that start surfacing.
Yeah.
Right. And Valerie, by her not using her hand, she's telling her brain that something's wrong.
Mm.
Valerie's mum.
Valerie's
Valerie's
mom.
mother. Yeah.
So that's so, you know, and so that's it's interesting, because we do focus on the part of us that is our living, or that our love, and then there's this exaggeration or spotlight on it.
And then
Yeah.
she doesn't have a way to express herself if that's the way she expressed herself.
Exactly. Yeah. Well, she's shutting down. It's a repressed expression, isn't it? If you think about it like that.
Good
It's a
point.
repression of loving feelings, you
Yeah.
know, because they've never been acknowledged or honored or whatever in her own life.
I think
And
self-compassion is so important, isn't it, in this field? It's, you know, that's the primary thing, is learning self-compassion. And when you begin to realize that symptoms are, you know, a signal from within, are maybe that part of us that's scared, you know, whatever it happens to be. And yet we're shouting at the pain, we're pushing it away, we're trying to push through the pain, we're trying to dig at things and find out what's going on. It all sounds too harsh to me. And I very much feel that we should be encouraging people to be self-compassionate.
Yeah.
Oh, wow. Yes.
There you are. Look at that. Yeah.
Yes.
Yeah.
Well, I am a physio, and I use my hands a lot, and I blame that on my hands being painful. But no, it wasn't the case.
But that's her. That's Valerie. That's her MO about it now. So none of us are going to be able to tell her. I mean, if she has an ounce of opening of like, oh, this is interesting, then you know, it would be. We all want our family. I mean, Rose and I talk about. Rose talks about her brother who's not so open, and you know, you know, and it's like it's hard. This is an issue. This is another show about, you know, spouses and family and friends of people with chronic pain.
Sure, but you can't be a zealot. And what do you call it? A thing I was never recognized in his own country. What's that saying?
The shoemaker. The shoemaker's son, or?
No. You know, the work you do is never recognized within your family, is what I'm saying.
Right.
Yeah. I like that look, Georgie.
I am so glad that my husband and my kids are fully on board, because I really don't know how I would have coped if at least they hadn't been on board.
Yeah,
I find it from my kids down, and I think, Rose, it's true. Like, our children really support us, but it seems like I don't know, it could be generational that, you know, and I think that sometimes people just don't understand. I mean, I was thinking about this in the beginning of the show when Rose was talking. It's just, you know, we're special, we're sensitive, strong people that get TMS.
Okay, look at it another way. They're stoic people that don't want to allow a feeling to come up because they're too stoic.
Yeah, it takes a brave person. John Sklar would say to us when we were doing the presence process work, he'd say, "You guys are courageous. You guys are going to climb a mountain emotionally. Like, who wants to do that? Go the other way. Don't." You know,
real copers. Yeah.
So, any more questions out there? Lots of people are watching. You've got some fans out here, Georgie, and Rose.
Really?
Rose always has her fan club. They follow her everywhere. Anybody else would like to ask a question? Because if you do, Georgie's here, but Georgie is available. She's on her Facebook page, and I know that she's available from us too. If anybody has any questions even after the show, you can always contact us. And Georgie, I'll send, oh wait, So wait, Zoe, I really identify with that. I wonder if I'd rather be in physical pain than dig around the emotional stuff. That's
Well said,
honest.
Zoe.
That's
Yes.
honest.
Yes, it can be tough.
This
Yeah.
is this is intimacy. In this is into me see. This was told me by a therapist. Into me see. Intimacy.
Yeah.
Yeah.
Look
This
into
is the
me.
real thing.
Yeah.
But this is this. I'd like to say to people that this is the bottom line. This is like where you will open up and know yourself, and you will not get stuck again in the way that you might have been, because it's all out there.
Sure, but we have to have ears to hear.
Good point.
Yeah.
And if when I've spoken to so many people, you know, people who do our success stories on the SERPA website, so many of them say, I am so glad that I've gone through this. I am so glad that I had pain, because I understand myself better now. I will never go back there again. You know, it's changed my life. It really is a personal development program.
Here's a question from Annie. How much TMS recovery is emotional discovery, and how much is changing mental beliefs? Good question.
It's both the same, isn't it?
I was about to say, I think both are important.
It's the same. It's the same. The whole thing is emotional recovery is about changing mental beliefs, isn't it?
Well, and I will say that Joe Dispenza will say your thoughts, you know, and then we have the Byron Katie work, you know, you have your thoughts, which our actions are based on our thoughts, and then we begin to believe our thoughts. And that becomes a pattern, like Rose will talk about, in, you know, patterns in people's lives because of our thoughts or because of what we heard growing up. So it's you're right, Rose, and you're right, Georgie. It is very similar. Very good question, Anne. For all these years,
Annie, the other thing to note is that often, as children, we've actually held back our own feelings for the sake of our caregivers.
Oh, yes.
And then we've held out that pattern and we've reused it over and over again. And then when we get this insight that this is an old pattern that's been safe for us, and then we realize all of a sudden it's not working anymore. And that's when we change our belief, and our system changes, because we see that it doesn't serve us well.
I always think that you know, we can't change anything until we become aware of it. And then
exactly.
Once we're aware of it, we can then choose to do something about it.
Yeah, and also I think going back beyond that, to choose something to do about it is about being aware that it doesn't work anymore.
Yeah, oh, absolutely.
It worked when we were 2 and 3 years old, but it doesn't work now. So there's no point in holding on to it. It's not about sort of so much changing our beliefs. It's being aware that it didn't work. It didn't.
You know what?
It doesn't work shouting, for example.
No.
You know, like as a child, you might have shouted back at your mother, but then when you shout at your husband, you're creating more grief in your family.
Example.
Yeah. And when you wake up to that and you realize that being angry is okay, but you don't have to shout about it. That's all. Yeah,
absolutely.
Sorry, Georgie, what were you going to say?
No, I was interrupting then. I thought you'd finished. No, I was just going to say one of our practitioners actually recommended a questionnaire, a free questionnaire online to us a few weeks ago. And it's a questionnaire about what your how you sabotage yourself. So it lists your self-saboteurs. It's
wonderful.
So good. And it explains each one on the website. It explains how you develop it.
Can you refer that to Tova so she can put it on her chat?
I will.
Now, Georgie, the other thing that occurred to me as you were speaking is you told me about this group in the UK that are a recovery group or something, but they actually have a questionnaire that the doctor, that a person can take to their GP.
Yes.
Can you tell us a little bit about that? Because I think that's very important as well.
And do you know
excellent.
What? I actually had the website up earlier and then I lost it. So mindbodymedicineinfo.org. And now I've lost you now.
What is it?
Mindbodyinfo.org.
Oh, it's what's her name? It's
It's Penny George.
yes, we're gonna have her in the fall, Penny, and because she's helping get information out for practitioners.
Yeah, so both Penny and George recovered themselves. Mindbodymedicineinfo.org.
Oh, good.
Very good.
Okay.
Now, Georgie, just elaborate a little bit about what they do, because that questionnaire can help. I mean, I haven't seen it, I haven't read it, and you have. Can you share a little bit about it?
It's really just a letter. The website is there and what they're trying to do is raise awareness within the medical world. So focusing on doctors, and we're only just starting with this, and they developed the website a few months ago, and we're just trying to build on that. They're talking to various organisations and really trying to get this work out there to doctors. So one of the things they've done is to write a letter that a patient could write, a recovered person could write to their clinician. Dr. Dave Clark has looked at it as well, and so he's made some edits because he's part of that as a clinical advisor. Yeah. And so it's a letter really just giving a background, a rough guideline as to why they need to be considering trauma, and basically saying, I've recovered and I was told there was no help for me, just to let you know I have recovered, and giving just a little bit about
Georgie. What's so wonderful, because we all want our doctors to be on board with us. We want them to say, hey, I'm really excited that you healed yourself. Like, we want them, because they're, Rose has taught me a lot about, doctors are sort of like the fathers. Sometimes they become the mothers or the fathers that we never had, and we give them this power. And then we get disappointed. Yep. And we're down in the ground again. Yeah. Wow.
And yet, quite often they just poo-poo it, and they just go, they're just not interested. But at least if they have a letter, it's a seed sown, and maybe when they see this, they look at it again, it might make a difference.
We invited Penny to come on in the fall. It'd be exciting to talk about this.
Oh, great. Yes, that would be good.
Well, I often give Alan Abbas's article that he put in the Family Health, Family Medicine Journal. It's probably 10 years old or more. But I often give it out to doctors, but they don't actually read it. And I find it so disappointing, because it's so well written.
Rose? Can we get a copy of that too? Alan Abbas's letter? I'm just going to make a note.
Okay.
Yeah. I'll make a note. That would be another wonderful thing, because he's talking about the ISTDP,
No, he's just talking about having an emotional focused interview. He's not promoting anything other than the fact that a doctor or any healthcare professional should have an emotional focused interview when they're talking to patients. So,
okay. He's a psychiatrist, isn't he, Dr. Abbas?
Well, yeah, but he started off as an ED doctor, and then he went over to Davonloo and trained in ISTDP, and now, of course, he's the world leading
I'm going to make a note.
And researcher in that area.
Excellent. I didn't know about that letter. Yeah. Excellent. I'm glad they brought that up. Excellent. We'll just write that letter. So, what's an ED? Yeah. He was into education?
No, emergency medicine.
Oh, wow. This letter. Very, very good. Great resources. Excellent resources. Yeah. You also wrote a book, Georgie.
I did, yes.
A key to
chronic pain, your key to recovery. And
that's the plan to write a book. Is that the back? Is that the sciatica? The book?
I published that in 2014, and that's due a review when I've got time. Not sure when yet, but I do want to. I do want to do that.
I keep saying, Rose, I want to write a book, and she's like, Tova.
Enough.
Yeah. But again, the reason I did it was because there were no books in the UK, and we can't all have everything being done in the States. So I just felt we needed to have a book written by somebody in the UK, and there are more books, being written in the UK as well, which is great.
You are really a pioneer. You're a pioneer. I'm so glad.
Yeah.
This show's going to be this particular show is going to be famous. it's going to be like, it's going to be archived. It's going to be amazing because Georgie, really
I
amazing.
don't think so.
Excellent. All the honor to you.
Yeah.
So we've had a lot of people come see it. I'm very happy when people come to our page because there's such amazing resources that Rose and I have been able to be messengers for. And together tonight we were more messengers and we connected to more people. And I'm just thrilled. So
Yes.
I really am happy. Rose?
Thank you, Georgie, for joining us. It's just been really great. Anyone who watches this or listens to this, it'll be on YouTube later, and you can comment there or ask questions there.
Yeah.
Tova or I, or even Georgie might actually have access to it and comment. So
Yeah.
thank you again for spending this hour and a half with us. It's been
Well,
really
thank
delightful.
you, and for all the work that you're both doing as well. You know, this is fabulous and reaching so many people through your work. So thank you.
Thank you.
You're going to make me cry. Okay, good night, everybody. God bless.
Bye.
Thank you.